More than half the world's population lacks access to essential healthcare. And if we take a closer look at the data for women and marginalized communities, the figures are even more staggering. Hi, my name is Vibha and I improve women's healthcare access in rural parts of the world through telemedicine. Having lived in more than 140 villages and worked with 12,000 women, I have seen the experiences of lack of access to healthcare very closely. Women often carry the burden of disease to the point of hospitalization. At Intelehealth, we believe that access to healthcare is a basic human right, and therefore we aim to connect hard-to-reach populations like the tribal populations, geographically hard-to-reach, inaccessible populations, conflict-affected populations with high-quality primary healthcare. We work with governments and NGOs on the ground to help them implement virtual care networks into the existing health ecosystem. We do this by providing governments and NGOs with three things: technology, training, and implementation support. Speaking of technology, we have an open source cloud-based technology which is very easy to localize. It is designed to help patients and frontline health workers in establishing a direct connection with a skilled medical expert anywhere in the country. For instance, our provider-to-provider app connects patients with a remote healthcare provider through frontline health worker. Similarly, our doctor-to-patient app provides home-based care through video consultation with a remote doctor. In addition to free and adaptable technology, we prioritize capacity building of health workers and doctors. We guide them on how to use digital technology and inform them the best practices for communication and patient-centered care. Lastly, in the implementation stage, Intelehealth works with partners to conduct community outreach messaging to drive behavior change. Because we don't look to invest in creating parallel health system, our model is scalable and sustainable. The existing healthcare infrastructure that are available, especially with the government, have a very good reach on the ground. Thus, working with government and NGOs ensure more efficient implementation and delivery of primary healthcare services. For example, we are currently working with the state government of Odisha and Jharkhand in rolling out the central government's eSanjeevani program. We have been able to cover a whopping population of 31 million and support more than 7,000 healthcare workers and 1,500 doctors. We have enabled 1.2 million teleconsultations. We are not just limited to India. We also have projects in Syria, Kyrgyzstan, and are growing our global presence. Per consult, we save over $11 in cost and 20 kilometers in travel. More than 80% of the patients report an improvement in their health status, and more than 75% say that they are likely to use telemedicine again. There is a long journey for us to embark upon, and we strive to cover 100 million people in 20 plus countries in near future. We also aim to scale our technology and reduce 90 million in health related expenses. Intelehealth exists to serve the bottom of the pyramid, and this is just the beginning. From where we started as an organization and the position where we are at today, we are one step closer to ensuring everyone has access to primary healthcare at their doorstep.